I'm good. I just want to hear my baby's heartbeat. I think I'm having another contraction.
You got this. This is going to track your contraction, so it's like a uterine contraction monitor.
Basically, we do sim labs. They're real life scenarios that can happen to you, and there's like a sim coordinator, and they're able to speak to you through the microphone into the room and hear your responses. So today we did a sim with a woman going into labor, and we just wanted to go in there, take her vitals, assess her pain, monitor the fetal heart rate and the contractions. Basically, make sure that the baby was in the correct position for labor.
Alright, it was fine.
The students within our pre-licensure program now will be able to actually experience live birth within our simulation center. We're able to bring this real life experience from the clinical setting, which they may or may not get to see, into our simulation where they have that safe time, safe practice.
It's like so valuable to have these like real life scenarios. I think it really helps prepare you for like real life situations. Without having that and just like going by like a textbook or like knowing what's gonna come next, you'd probably be a little shocked on your first time with a patient.
We're growing, we're being innovative as much as possible, which is the biggest thing here at ASU, and that we are providing those real life experiences just that they would see in the clinical setting, here hands-on learning in a safe environment.
They really prepare you for the real world, and I think I'm going to be set up nicely to transition to practice.
How are you feeling this morning?
Oh, I'm just ready to have this baby.
There we go. We're good.